Hello, I'm Dr. David DeRose. I gotta tell you, no matter who they are, patients coming through my doors, patients coming to lectures that I've held over the years, people listening to my weekly radio show, it seems that when I sit down and talk with people, whether it's in a public venue, whether it's in a more remote context, one of the biggest fears that comes up is a fear of cancer. All of us can bring up images of people we've known or people we've seen depicted who have had the lingering results of a chronic cancer that just was not responding to treatment. But as scary as cancer is, there is encouraging news when it comes to cancer. We hear about encouraging cancer therapies, we hear about new trials, but still, in the midst of both the fears and the excitement about positive expectancy when it comes to treatment, there's still a question. Might there be a missing link when it comes to your own ability to prevent or even treat cancer? I think there is. And that missing link is hemorrheology, or blood fluidity. Because lay people over the years have told me hemorrheology is just kind of a difficult term to even get your lips around sometimes, I use the term the Methuselah Factor to refer to blood fluidity. The research is really fascinating. I crystallized some of it in Chapter 6 of my book, The Methuselah Factor. Chapter 6 was actually entitled, Improve Your Methuselah Factor, and guess what? You got it. In light of what we're talking about, decrease your risk of cancer. So what does blood fluidity have to do with cancer? I mean, after all, most people would say, well, I could see how blood fluidity would impact our risk of a stroke or a heart attack, maybe even joint problems, maybe even vision problems. Those may seem somewhat intuitive, but how would blood fluidity and worsened blood fluidity put you at higher risk for cancer? Well, one of the interesting studies that looked at this was done by George Friedrich von Tempelhof and his colleagues. They looked at over 400 women who had female cancers. They measured indicators of blood fluidity. The women that had worsened blood fluidity, no surprise, they had greater risk of having clotting after their cancer surgeries. But what was really remarkable is that the women who had worst clotting factors, in other words, they had thicker blood, poorer blood fluidity, they had lower survivals from their cancer. Now you say, again, well, why would there be this connection? Let me just read what the researchers wrote, and we have it quoted here in our book. I'll kind of walk you through it here. They put it this way. In gynecologic cancer patients, the combination of an increase in RBC aggregation and plasma viscosity impairs blood flow properties. Now, what they've been saying, using a lot of big words, is in these female cancer patients they were dealing with, things that worsen blood fluidity, like RBC aggregation, that's red blood cell aggregation or tendency of your red cells to clump together, and plasma viscosity, a measure of blood fluidity. If those things are worse, it's going to worsen your blood flow properties. Listen what they say then. As those blood flow properties are worsened, it may induce hypoxia in the microcirculation. What that means, you get less oxygen to your tissues, at least in the small blood vessels. That favors thrombosis. In this context, it would mean little clots in your tiny blood vessels. And then settlement of tumor cells and thus metastasis. What the researchers are saying in plain English is if you don't have good blood flow, if your blood is not fluid, you'll have microclots, if you will, in your tiny blood vessels. And then when cancer cells are circulating through your body, and by the way, if you have a cancer, the current thinking is typically those cancers are putting off cancerous cells that most of the time your immune system gobbles up. But in this case, if those cancer cells can lodge in a tiny blood vessel that's now isolated from your circulation, they can set up metastasis, or the spread of cancer. So what we've been looking at really is a potential missing link when it comes, in this case, to even surviving cancer. If your blood fluidity is poor, you're at greater risk of dying from cancer, at least in von Tempelhoff's research. But researchers have found that there's a connection between ever getting cancer in the first place and blood fluidity markers. Although we don't have time to go through all the research, we touch on some of it in the book. Let me do this. Let me make this really practical. Because it's one thing to say improve your blood fluidity, but you might be asking, what can I do? Sure, you can get my book. You can go through the whole 30-day program that we outline with a different task each day. But let me just give you one thing you can do. I have a chapter entitled Eat Fast. And there's a comma between those two words. I'm not telling you to see how quickly you can eat, but rather to eat at appropriate times and then also to fast. There's a specific fast that I recommend you give consideration to. I call it the leaf, stem, and flower fast. In this fast, for a day or perhaps a couple of days, what you do is you can eat any vegetable that's a leaf, a stem, or a flower. That means spinach, broccoli, cauliflower, Brussels sprouts, kale, collards, all are fair game. Celery, asparagus, you get the picture. Anything that's a stem, a flower, or a leaf, you can eat on this fast. You can cook them, you can eat them raw, you can juice them. You say, what's the advantage of this? Well, the research suggests that fasting and modified fasts, like the one I'm describing, can significantly improve your blood fluidity. But there's more to the equation when we speak about cancer. These foods, these plant foods, are loaded with phytochemicals, plant compounds that actually, many of which have been shown can actually help you prevent cancer. So when you're eating these isothiocyanates, that's one class of these phytochemicals, you are eating cancer preventive compounds. The missing link to cancer prevention, to cancer treatment, may be not having optimal blood fluidity. Improve your Methuselah Factor. Improve your Methuselah Factor and decrease your risk of cancer. That's what the research indicates. How to do it? One way, include fasting as part of your program. And if you do something that I enjoy recommending and enjoy these foods myself, the leaf, stem, and flower fast, you'll be giving yourself some powerful phytochemicals that also help in your battle with cancer. I'm Dr. David DeRose, wishing you the very best when it comes to finding the missing links connecting you to better health.